Doctor, I've heard about the carotid artery ultrasound test before, but to be honest, I don't really know what it is. Do I really need this test?
That's a great question. A carotid artery ultrasound is a non-invasive test that uses ultrasound waves to examine the carotid arteries in your neck. These arteries are crucial for blood flow to the brain. The test is completely safe and helps detect signs of arterial hardening, atherosclerosis, without putting any strain on your body. Today, I'll introduce 4 key benefits of getting this test.
Thank you. But arterial hardening sounds pretty scary. I feel like it doesn't really apply to me.
Actually, atherosclerosis is often called a silent killer because it develops without noticeable symptoms. If left untreated, it can lead to strokes or heart attacks, which are serious, life-threatening conditions.
So this condition can actually cause such severe diseases? In that case, should I get tested as soon as possible?
Exactly. Getting a carotid artery ultrasound allows for early detection of atherosclerosis, so you can start prevention and treatment sooner. It's especially beneficial for people with high blood pressure, diabetes, high cholesterol, or smoking habits, as these factors increase the risk of arterial hardening.
I see. But honestly, medical tests make me a little nervous. Does this test hurt?
There's no need to worry. This test uses ultrasound waves, which means there's no pain, no needles, and no radiation exposure. It's completely safe and non-invasive, so you can relax during the procedure.
That's a relief. But what exactly are the benefits of getting this test?
Let's start with the first benefit. This test assesses the condition of your arteries throughout your entire body.
The entire body? But the test only looks at the arteries in the neck, right? How does that tell us about the whole body?
That's a good question. The carotid arteries are some of the most susceptible to atherosclerosis. If arterial hardening is found here, it's likely that other arteries in the body have similar issues.
So, the carotid arteries act like a mirror reflecting the condition of my whole body's blood vessels? But why the neck? Couldn't we check other arteries instead?
Great point. The carotid arteries are easily accessible and produce clear ultrasound images. If atherosclerosis is detected in the carotid arteries, it strongly suggests similar risks elsewhere in the body.
That makes sense. But hearing about arterial hardening all over my body makes me wonder, what if the test finds something wrong? That's kind of scary.
That's exactly why getting tested early is so important. If we find anything, we can take action before it gets worse. The key is to understand your current health status, so you can prevent future problems.
That makes sense. Knowing my condition sooner rather than later would definitely give me peace of mind.
That's the right mindset. Now, let's talk about the second benefit. This test assesses your risk of stroke and heart disease.
Stroke and heart disease? Those sound really scary. Can this test really detect risks for such serious conditions?
Yes. The carotid artery ultrasound helps us check for arterial narrowing, blockages, and plaque buildup, all of which are major risk factors for stroke and heart attacks.
Plaque? That sounds complicated. How does that affect my health?
Plaque is a buildup of cholesterol and other substances in the arteries. Over time, it can narrow the blood vessels or even completely block them. If this happens in the brain, it can lead to a stroke. If it happens in the heart, it can cause a heart attack. When we find plaque in the carotid arteries, it suggests similar risks elsewhere in the body.
So this could lead to sudden collapses or major health problems. That's terrifying.
Yes, that's why early detection is crucial. Strokes and heart attacks often strike without warning, but a carotid ultrasound allows us to identify risks before they become emergencies. If we find early signs, we can start treatment and lifestyle changes immediately to reduce those risks.
So knowing my risk in advance helps me take preventative steps? But do healthy people need to worry about this too?
Yes. People with high blood pressure, diabetes, or high cholesterol are at higher risk, but even people without symptoms can develop atherosclerosis. Many doctors recommend starting screenings at age 45, especially for those with family history of heart disease.
I see. Ignoring it doesn't seem like a good idea. Getting tested would definitely give me some peace of mind. But I still worry about pain and radiation exposure.
That's understandable. Let's move on to the third benefit. This test is completely safe and painless.
That's a relief. I always imagine medical tests being painful or involving needles, which makes me a little hesitant.
There's absolutely no pain involved. The ultrasound probe is simply placed on your neck, and a bit of gel is applied. The only thing you'll feel is a slight cool sensation.
That sounds really easy. But what about older people or pregnant women? Would it be difficult for them?
Not at all. Since this test is gentle and non-invasive, it's completely safe for elderly patients and pregnant women as well.
In that case, I have nothing to worry about. But can such a simple test really provide accurate results?
Absolutely. Ultrasound technology produces high-resolution images that allow us to precisely assess artery health. That's why it's widely used as a reliable diagnostic tool. Once you take the test, you'll see just how quick and simple it really is.
I never realized such an easy test could be so useful. I feel like getting an appointment won't be as intimidating now. Could you also explain how this test helps with early detection and prevention?
Of course. The fourth benefit of this test is that it plays a major role in detecting and preventing atherosclerosis early. As I mentioned earlier, arterial hardening is a silent killer. You won't feel symptoms until it's too late.
A silent killer? That sounds terrifying. Does that mean people only find out once it's already severe?
Exactly. By the time symptoms appear, arteries may already be severely blocked, increasing the risk of stroke or heart attack.
That's scary. So without this test, I wouldn't even know if I had a problem.
That's why early screening is so valuable. If we detect atherosclerosis before symptoms appear, we can prevent it from getting worse through lifestyle changes and, if needed, medical treatment.
That makes a lot of sense. If I know my condition early, I can start making changes now.
Exactly. This test allows you to take control of your health and reduce future risks. I highly encourage you to consider it.
Doctor, after hearing all this, I'm convinced I want to schedule my test.
That's a great decision. Being proactive about your health is the best thing you can do. If you have any concerns before or after the test, don't hesitate to reach out.